Uh, okay, fine. So basically, we were discussing about the different type of injury that can be seen during any kind of road accidents or disasters. And the commonest injury that need to be assisted first will be the head and the abdominal injury or the chest injury, which can cause internal bleeding. So what first response we can do? We are not doctors, we are not experts in that field. So what kind of first response we can do? If you recognize that as a internal injury, that itself will save the life of a person. So most of the time we wrongly take a decision that the person may have already dead, or we may be assuming something else, and we try to help by giving water or doing other things which may not be required. So basically, identification plays a major role, and the golden 1 hour concept applies to such kind of injuries, and respond as early as possible. And if you come across to be the part of a response team, suppose if you are there on the site, so try to identify such casualty and make sure that they are shifted on priority basis to the hospital as soon as possible. Okay. So the next part is regarding the fracture that can commonly. I request to mute your speaker, please. Okay. So next type of the injury that can be commonly seen during either a building collapse or a train accident. We are discussing about the generally about any major disasters only now. So in such a type of injury will be the fracture, the commonest injury. So while managing fracture, the basic thing that is required is identification, and second is to reduce the pain, is to reduce the swelling, and to reduce the mobility, and safely shifting such casualties to the hospital. So identification of fracture is very important. How to identify fracture? Apply our basic science skills, basic simple anatomical skills. So in case of any fracture, the fracture can be generally divided into two, that is open fracture or closed fracture. Open means to say the open ends can be seen outside, and closed fracture may not be seen. So when it is closed, there it is difficult to identify whether it's a cramp, whether it is twisting of the muscle, whether it is a sprain or strain. So what are the identification features of the bone fracture is three: a severe pain, swelling, and loss of movement. If you see all the three, like a swelling, pain associated with the loss of movement, when the person is unable to lift his hand, when the person is unable to lift the leg, at that time we have to assist him, we have to provide assistance to him by providing using a splint, or you can use any type of wooden board, or you can use a stick, you can use scale, something like that, to make sure the fractured bone ends are moved, not moved further apart, and it will reduce the pain also. So how exactly we do that in case of any fracture? This is not the medical part which I'm discussing. I'm discussing about the general first response. Medical part and the medical line of the treatment is much more higher than that. But first response as a general public, or for example, a person from a non-medical background, definitely can identify this fracture, can support, can provide the first aid, and shift the casualty safely. So how to provide a support? What we have to do is stabilization using splint. So what kind of splint? A wooden splint provided, probably it will be available, or a plastic splint also nowadays it can be used. You can use even a plastic water bottle also. It's not that you have to use uh, standard material. When nothing is available during disaster, a common locally available material can be used and to support. What is the advantage of doing this? Why we need to do this? Imagine the train accident that happened in Odisha. There are hundreds of people who had bone fracture. And if you shift them without doing any assistance or first response at that moment, the pain will get aggravated. The person may go for shock, and that can cause. I request to switch off the microphone, please. I think I can mute it. Yeah. All right. So fine. So please remember, in case of fracture, the basic thing to be remembered is stop any bleeding and don't try to realign the bone. So don't try to realign it by yourself. Then immobilize the injured area. Then we can apply the ice packs. We can apply the cold pack. and to limit the swelling and to relieve the pain also. So this is a common things, and what we are discussing today is about the first response only, and it's a more about the first aid which can be done during any such emergency. It's not only about any emergency, like for example uh, a road accident or a common household related injuries also, we can apply set of skills to save your life. So splinting, stabilization can be used, splinting can be done, arm sling can be done. So to make this, you don't need a specialized equipment, whatever locally available can be used, right? So this is about the first aid management, and there is a one type of bandage. I don't know how many are aware about this type of bandage is called triangular bandage, and we can make nearly 20 different type of bandages with this bandage. It's called triangular bandage. If you cut a 100 square centimeter cloth into diagonally, it becomes two triangular bandage. We can prepare a stretcher using this. We can make bandage. We can make 10 different type of bandage, not only one. We can use it for head injuries. We can use it for shoulder injuries. We can use it for back injuries, leg injuries also. It's called triangular bandage. You maybe have seen the scouts and guides students will be wearing the scarf. The scout scarf is nothing but a triangular bandage, which can be which you can make arm sling, you can make a bandage, we can make a stretcher also using that. So there are simple applications of use of this material, and which can be used in case of any such emergencies, right? So spinal cord, this is a very important part and a very sensitive part that should be protected during any emergencies, during any disasters like building collapse, earthquake, or road accidents. So spinal cord is the most ignored and the neglected part during accident management. The reason is the people are unaware about the importance of the spinal cord that it can provide. It's a control room for all the movements of the body. If it gets injured, the person will be disabled for life. He will be paralyzed for life. And more than 4 lakh cases of paraplegic cases are reported in India, or paralyzed cases are reported after the accidents every year. That is due to, not due to the injury, it is due to the wrong handling, wrong shifting of the casualty that can cause injuries. So, how to shift, how to identify, how you know that whether the person is having a spinal injury? It's very simple. After you approach a casualty, injured person, if he is unable to move, if he is unable to lift his hand, if he is unable to lift his leg, that indicates that spinal cord is injured. Apply the protocol. We have a standard operating procedure for spinal cord management injuries. So protocol says that wait for the ambulance to arrive, wait for the experts to arrive. If you are using, if you are lifting, we have to lift taking a support of a spine board. We call it a spine board. I will show you how to do that. So spinal cord is a very important organ, need to be protected in all emergencies. Okay. If the person is conscious, he will say that he is unable to lift his hand and he is unable to move the uh, leg portion. But if the person is unconscious, so how to identify? That's a difficult part. So the protocol says that if all unconscious person should be treated as spinal cord injury and the care should be taken. So I'm talking about the pre-hospital care and the disaster management. It's not about the hospital care. So, okay. So uh, what should be done when someone is having a spinal injury? So when someone is having a spinal injury, first is identification. Identify that whether it's a spinal injury. Second is you need to protect the neck. You need to make sure the neck is immobilized by, as you see in the picture here. So we need to support the neck portion like this. Okay, till the ambulance arrives to the scene, till the experts take over from you, we need to do this procedure. So how exactly to do it? What is the exact procedure to do this? Is immobilizing it, followed by using a spine board. So how to use a spine board? So spine board. So this is, I don't know whether the slide is fully visible here. So be smart, stay safe, and never move a conscious person complaining of a spinal pain, numbness of the leg. You just save them, but they may be probably if you shift, probably they will be paralyzed for their life. Okay. So first thing is, till the ambulance arrives, you need to give a cushion. Where exactly? Lower back and the neck portion. Cushioning. Soft cloth can be given, not a hard portion. You can see in the picture in the diagram there, a soft cloth is provided. Okay. If 3 or 4 people are there, what we can do is support the neck portion. So support the neck portion, wait for the ambulance to arrive, wait for the stretcher. In this condition, person may be conscious. Spinal cord injuries are the commonest injury that can happen during falling from height, building collapse, earthquake, road accident, high velocity injuries, whiplash injuries. So can happen in such a kind of scenario. scenario. And then the casualty handling is very important. And most of the first responder, we have a very strong department now, that is NDRF, National Disaster Response Force, which comprises of police and the paramilitary force, which are trained and equipped with handling. But at the same time, if you are there, if your volunteers are there at the scene, we can support them while shifting the casualty. The recent mine tragedy, I cannot call it as a tragedy. It was a success story. I can call it as the tragedy was happened after a collapse. After the collapse, but all the occupants of the mines, the mine workers, was saved because of the extraordinary effort of the various departments of government of India, extraordinary effort of various workers there. But we cannot call it as a disaster because it was very effectively managed, even though it was delayed for days together. But none of the workers got hurt, none of the workers got physically sick. So that was a good part. But we can support the general public, can support in such scenario in providing any kind of assistance in shifting. So shifting means to say casualty handling. This is the most important part of the disaster management. In case of a train accident, when you are shifting, don't try to shift a casualty holding them by leg and hand. If you try to shift them by holding leg and hand, there is a very likely chance that spinal cord may get injured. And a very important equipment that may be required at that scene is a spine board. As you see in the picture here, we call it as a spine board, and the spine board is the commonly used one. And generally, in case of any such emergencies, we will be using the spine board. And the spine board is nothing but a flat plastic board which prevents the movement of the spinal cord. So this is very helpful in such emergency. Cushioning, proper cushioning should be done. Proper stabilization should be done while shifting. And it's important to stabilize. Without stabilization, if you shift, definitely it can cause further movements. Okay. Then there are different methods of shifting the casualty in disaster. So what methods I'm going to discuss, it applies not only for spinal injury, it applies to the all type of injuries that can happen during any such emergencies. Okay. It applies to many other. Okay. Uh, Fine. Okay. Next one will be the transportation of injured person. And when you are transporting an injured person, this is fireman's lift, commonly adopted in case of any fire tragedy. So when in case of a fire, you cannot expect many rescue workers to enter the scene. There will be one person who will be entering with a provided with the oxygen mask or with self-contained breathing apparatus. At that moment, he can rescue a one person who is trapped inside a smoke and fire using a fireman lift. This is one of the simplest technique to lift a casualty, injured person. That's called fireman lift. So commonly adopted in a war scene, conflict like situation also. You may have come across the scenes of Ukraine, Russia war, or in Israel and Gaza. There are many injured people who may be soldiers, who may be civilians, but generally they can be moved if nobody is there to help with a fireman lift. Okay. So fireman lift is this is one of our training for the department, police department. Fireman lift is simple and very easy to adopt, and there are modified methods when nothing is available. I am talking about when stretcher. Imagine, assume for a moment the train tragedy that happened in Odisha when thousands of people are injured. We don't have a stretcher. Thousand stretcher You cannot imagine 100 stretcher, where the 1,000 stretcher. It's not possible to have 1,000 stretcher. So we need to use our hand, but effectively and safely. The safety first and effectively. So the 4.5 method is again one of the method for non-spinal cord injuries. When a person is unconscious, we can use this technique of 4.5. We call it as 4.5. And this is a wrong method of shifting, handling the casualty. This is very wrong. As you see in this picture, there is a blast which you can see behind the picture. So you can see 4 or 5 people shifting a casualty. It's after a bomb blast. And if you can see how the injured person is shifted, it is a very wrong procedure. You can see there are 4 rescue workers or first responder. There 4 or 6 totally, and just look at them, how they are holding the leg, how they are holding the hand, how they are pulling the hand, and the body. You can see this sagging down, and this injury may get aggravated. Bleeding may get aggravated. The fracture may get aggravated, and this is not only in any country, in our country also same. The same method they adopt while shifting any injured person, holding them by leg and hand. Please don't do that. This is very wrong procedure. And if you shift like this, you may save a life, but he will be disabled for life. He will not he will not move at all. Okay, so this is wrong. How we can shift it in such a situation? Imagine same situation. We have 3 rescue workers there. So how exactly you can shift? We have 3 rescue workers. How exactly? So you can adopt this method. It's called human stretcher. In this method, it's very simple. 3 people we require. We don't require 4 or 6 people. So what exactly done is all of them are sitting in a one knee down position and extending their hand and holding the casualty, supporting the neck portion, supporting the back portion, lower back and the leg portion. So it's called human stretcher or human lift. To load a stretcher, this method can be adopted. Just see the picture, one picture earlier, and how it could have been done in a more safer way when there is no stretcher. Stretcher, if you have, it's well and good. Stretcher is available for all the cases of road accident, but not for the conditions like disasters where you have to go for alternate stretchers. Then this is again from one of our training for anti-Naxal police. We call this as a human stretcher or a human lift method. This method can be adopted for loading the casualty to the vehicle, ambulance, or to the stretcher also. This is a easy and the simplest method that doesn't require any set of skills or anything. You don't need any specialized equipment also to do this. What you need is a application of your skills properly. So you can see the 4 commandos supporting casualty there, and the other side you can see me supporting. If the person is too heavy, the other person can support from the other side. Otherwise, 3 people are more than enough. The first lift will be like this. This is first lift. The second jerk, when we stand up, we will be doing like this. Okay. So this is one of the method called this is a method called human stretcher. In case of any such emergency, we can use this. And there are methods like forehand method, and this forehand method is a very simple method to shift the injured person to the ambulance or to the vehicle. Remember, during the Gujarat Bhuj earthquake in 2001, most of you can remember that, and more than 12,000 people died in that incident in Gujarat Bhuj earthquake. So the buses, nearly 300 buses, they have removed the seats and they converted that into a mobile stadium. And the forehand method was most aptly used at that time to shift the casualty. When no stretcher is there, a person is having injury to the leg and abdomen and chest. Very simple, very easy, very convenient. So we just lock our 4 hands and make a human seat and to try to shift the casualty. Okay. And the Bhopal gas tragedy also reminds us, it happened in December, if you remember, December 4th and 5th midnight, it happened, the Bhopal gas tragedy. And that Bhopal gas tragedy also at that time, how the casualties were handled. There is one documentary or movie I can say, if you happen to see that, it's called Railway Men, or the movie name, probably. If you happen to see that, please see. And so systematically, the disaster was managed by the railway officials on that day, moving the people away from Bhopal And that movie unfolds many things. The crisis, how we manage, how badly the crisis can be managed. Also, we can see in that Bhopal gas tragedy, if you remember, that happened way back in 1983, and that is killed more than 10,000 people as per the official statistics, but unofficially, God knows, more than 50,000 people may have been killed in that incident during a gas leakage. So disaster doesn't mean only the building collapse. It doesn't mean only the earthquake, flood, or rainfall, heavy rainfall, or the cloud burst. Even man-made disasters like in your city, there may be industry, there may be disaster which is waiting to happen because of lack of safety measures, lack of proper precautions to prevent disaster that can happen. So Bhopal gas tragedy is the worst example I can quote, where if the industries, the private industries, if they do not follow the safety standard, if they do not adopt the safety related to the chemical, what they store inside in the large quantity, it can kill thousands of people. And that was the worst industrial disaster that happened in the 19th century, was the Bhopal gas tragedy, killing thousands of people and affecting lakhs of people even today also. Okay, fine. Next is chairlift. If you don't have anything to lift a person, you can use a chair also as a human stretcher, as a stretcher. So this also can be used. There are alternate various methods are there. This is for your knowledge. Just remember that it's not the stretcher requires every time. We don't need a stretcher every time. We can use our hand, convert that into stretcher. We can use a blanket. We can use a triangular bandages. We can use a pole, a bamboo pole, or to convert that into stretcher also. Okay. So when many volunteers are available, you can use a blanket or a floor mat. ನಾವು ಕನ್ನಡದಲ್ಲಿ ಏನು ಚಾಪೆ ಅಂತ ಹೇಳ್ತೀವಿ, even that also can be used as to shift the casualty. So this is most commonly used during any disaster. It's more simple, more easier, convenient for the injured person also, because his hands and legs will not be touched. And this is also easy method to shift any bedridden patients to the hospital. During COVID, this was the most commonly advised and used method to shift the bedridden patient from home to the hospital. uh, when we don't have an access to sufficient number of ambulances. If you remember, I don't know whether you recollect the days of COVID, the first wave and the second wave. My team, means to say our team, was working in the field, and it was like a warlike situation, I can say. For everyone, most of us, it was like a lockdown, sitting at home, doing nothing. But for the people, first volunteers like us, and it was like a warlike situation, with total chaos and confusion, total myth, total misunderstandings, and total fear of the pandemic that happened. Anyway, that was the worst experience which we faced during 2021 and 22. But God knows, new infections are reported in China and many other parts of the country as well. So please be aware about those infections, because college is a place where hundreds, thousands of students will be there. If one person is having any infection, that can rapidly spread into other people. So remember the COVID protocol always. For the next 10 years, you have to follow the COVID protocol. You have to adopt the COVID protocol. So don't think that COVID has left us. No, no, COVID is still there. Only thing, we are not afraid of COVID. That's all. So anyway, coming back to the disaster management part of the shifting casualty, you can use this. This is again from one of our trainings. Uh, you can use this, the blanket stretcher. We call it as a blanket stretcher. Okay, so this can be used to shift the casualty in case of any emergencies. And blanket here, what we are using is ground sheet. We call it as a ground sheet. It's a tarpaulin sheet. This is again from one of our trainings. When you don't have access to the stretcher, you can convert that into a stretcher also, but we need to have the knowledge. Don't hold the ends of it. Fold it completely, roll it, and then you have to shift it. Then the common thing that can happen after a building collapse, after an earthquake, or major train accident or major bus accident, is the fire. We are going to discuss about the fire related injuries. Fire can happen in any office building, college building, or any building for that matter. The fire, is the commonest disaster that is reported in India. Okay, we cannot classify. So when you discuss about disaster definition, probably yesterday the resource persons may have mentioned, when we call an incident as a disaster, so any incident or an accident or a situation which cannot be managed with a local administration, we can call it as a disaster. But generally, fire can be managed by the fire brigade department, and for now it is called fire and emergency services, the department. But there are situations which is difficult to manage, and we need to have the knowledge about the fire. So please understand, controlling fire, we need to understand the simple science behind the fire. And the fire is a chemical reaction, and it's a combination of three factor, that is heat, fuel, and oxygen. And in case of heat, fuel, and oxygen, the first thing is, if you remove any parts of the triangle, the fire will be under control. So have a knowledge, each of your college building is equipped with the fire extinguisher. If it is not equipped, make sure that you get it. Okay, so you make sure that either you get it by the department, by the authorities, or by probably somebody contributing or donating it to the college or to the institution. We need fire extinguisher. So every building needs a fire extinguisher, because this is the first aid for preventing the fire to become a disaster. So please have a knowledge about how to operate fire extinguisher. It is operated by simple method called pass system. PASS pass. PASS pass means to say, pull the safety pin. We pull the safety pin, aim at the base of the fire. We aim at the base of fire and then squeeze the trigger and sweep from side to side. So that is a pass system for operating any fire extinguisher. And this is a tragedy which I can mention here. So that happened way back in 2012-13. That is Carlton Tower fire tragedy that happened in Bangalore. So in this incident, particularly, this is an eye-opener incident for uh, okay. So this is an incident that probably reminds us the lesson that need to be learned about do's and don'ts of a fire. This incident, if I can remember the story of the Carlton Tower fire tragedy, even now, if you search the Google Carlton Tower fire tragedy, you can see the YouTube videos of people jumping out from the 8th floor. So on that day, there was no fire in the building. The whole building was filled with the smoke. It's a multi-story building in Bangalore, at the heart of the Bangalore. So the whole building was filled with the smoke, and the occupants of the lower floor just ran away, escaped. Occupants of the high-rise part were trapped. They are all software professionals, corporates, and business management professionals. And education-wise, they have a very high education. They didn't know what to do. So at that time, they broke open the glasses, because it's a centralized air conditioned building. There was no way the smoke can go out. They did the right thing, but they should have broken more number of windows, but they opened only few windows. That made the smoke to increase. And the fire brigade didn't come in time due to the traffic jam that happened around the building because of the curious onlookers. The fire brigade couldn't able to reach the scene in time, and these people jumped out of the 8th floor. All of them died on the spot due to the head injury. And these visuals are there still in the net. You can see these visuals on the net. And this is an incident where please understand, all of them are not uneducated people. They are highly educated people. And jumping out from 8th floor, nobody can survive. So when someone gets trapped inside a building, please remember the do's and don'ts of a fire. Never try to jump out from either the first floor or second floor or whatever the height. Nobody can assure you that the person will be alive. Okay. So how to save themselves if you are trapped by a fire and the smoke? If you happen to be inside a room or a chamber which is trapped by the fire. The fire can happen in any building due to short circuit, due to air conditioners, due to faulty wire, due to overloading. So there are many reasons. In detail, we can take about what are the reasons for electric short circuit. But escaping a fire, you need to have the set of skills. Not only in Bangalore, it happened in Mumbai, it happened in Gujarat, it happened in Calcutta, where people have jumped out from the high-rise building to save themselves by by the smoke. So if you happen to be trapped by the smoke in such an emergency, what you are supposed to do if you are trapped by fire, stay close to the floor. So by crawling method, you have to come out of the room. Never try to stand up, never try to run, because smoke is lighter than the air. It will be at a higher level. If you crawl, if you bend down, there will be fresh oxygen. Cover your nose with a wet kerchief and you can come out of the building. Okay, right? Then next part is about for burns. What is the treatment? If someone is having under fire, the first thing is don't make him to run around. So make him to fall, drop down, and cover with a blanket if it is available. If it's not available, drop down and roll is the correct method for controlling fire. And for burn, what is the first aid? So there are many things related to the burns. I will not go in detail. There are degree of burns which we classify into first degree, second degree, third degree burns. And generally for any burns for that matter, the first degree or second degree burns are okay. If it is a third degree burn, it may be fatal also. So this is about the different types of burns. What is the first aid? Oh, how we need to respond is, what is the first aid for burns? Burns, the first aid for burn is, give me a moment, it's not changing. Okay, so the first aid for the burns, for the minor burns, will be using cold water, the running water for 10 minutes. So application of the cold water for 10 minutes is required in case of a burn related injuries. So remember the rule of 10 minutes application of running water. So there are myth and misunderstandings related to this. The people assume that putting water can cause infections, it can cause blisters, it can cause pus formation. All these are myth. Water is the best remedy for the burn injury. In case of burn, water should be applied. Okay, and whatever the blister forms, that forms because of heat, not because of the water. And inside the blisters, you can see a transparent fluid that is not the pus, that is the pure plasma, which is meant for the healing of the wound. Don't try to puncture it. Okay, the blisters will form in case of burn injury, and don't try to rub, don't try to apply oil. So put the water for 10 minutes, running water continuously, and then you have to cover that with a plastic cover so the dust will not be falling on that, and take them to the hospital and shift them to the hospital. So this is about the first response in case of a fire. Please remember the things which is not supposed to be done. Don't delay in getting any medical help. Don't remove anything which is struck, and don't apply the cream. There is a we have an understanding of application of common Bernol, or there are creams which are greasy. But application of this cream can be done later, but not immediately. Immediately you have to put the water. Okay. Don't open the blisters. Don't burn it open. Right. Then we are coming to the next part, that is about the drowning in case of floods. So related to drowning, how we manage drowning, and how we can help in case of a drowning. So in case of drowning, the first thing to be remembered is don't try to enter inside the water. One or two slides are missing here. Let me show you that part. Okay. Uh, the first aid for the drowning, if somebody is drowned in the water, there are many cases reported of drowning in Karnataka or in any other state for that matter. And most of the people who are getting drowned are the college students or the youth only. So why youth? The reason is they go to the places which is having water or the backwater of a dam, a reservoir for swimming purpose, and they go in a group. In the group, one or two person may be there who may not be familiar with the swimming. When they start to drown, the other people will go forward to help him, rescue him, and all the four or five people will drown. So you may have heard about such situations. You may have read in the newspaper. You may have seen in the TV also, TV news regarding this. And the most of the death related to drowning is not reported during rainy season. It is reported during summer season. So why summer? The people will go in search of water during summer, and they enter inside the water without any precaution. They end up with a drowning. So what should be done? So in case of drowning, if you want to help someone, if you are trying to help someone, so the first thing is you should wear a life jacket. Without life jacket, don't enter inside the water. If you try to enter inside the water, you may be the victim also. Remember that. So non-contact rescue is the best rescue in case of a drowning. How to do the non-contact rescue? Using a rope, using a cloth, using a stick, you can rescue a person. But if you're doing contact rescue, you have to enter inside the water. Okay, so remember that entering inside the water to save a life in case of any emergency, then approaching from behind, not from the front. So once you rescue them, the method of draining water, there are so many myths and misconceptions related to the draining water. You may have seen people pressing the abdomen in the movies. So this is not recommended. There is no point in pressing abdomen because water in the abdomen will be drained. We need to drain the water from the lungs. So to drain the water from the lung, we place the person face down position and we try to press the shoulder blade to remove the water. And after that, we give mouth to mouth breathing. And for this giving mouth to mouth breathing, you may use any barrier device also. There are many barrier devices are available in the market which can be used for management of such emergencies. Barrier device is best one, or you can use directly mouth to mouth breathing followed by external cardiac compressions. We call it as cardiac compression, which we are not discussed about how the method of doing it, which we are going to discuss now, how to perform the CPR. So how exactly to perform the CPR in any such emergency, you need to have a knowledge regarding that also. Please remember the proper method of CPR and don't hesitate to come forward and provide a CPR in such emergency. I can remember one incident that happened in Udupi district, probably during COVID time. That incident was a moving car, lost the control and fell into a river, right? It was not a big river; it was a small river, but the water was flowing at a very means it's a rainy season. The water was flowing at full level. So the car has fallen into the river, and the locals, the bystanders, came forward to help. And by the time the local fishermen came forward to help and remove the occupants of the car, it was delayed by 10 to 15 minutes. 10 to 15 minutes is the shortest time I can say for any rescue. Immediately, such rescue may not be available immediately. So when they rescued the occupants of the car, so they thought that they are already dead. They have swallowed too much of water, and so they were the bodies were placed on the banks of the river and they were waiting for the police. And one student, a ninth standard student who came who saw the crowd in that place and stopped the vehicle. She was going in a two-wheeler with her relative. She's a ninth standard student, and she stopped by, she came forward, checked the pulse of the injured person, checked whether they are breathing. She thought the one of the occupant of that car, passengers of the car were one lady. She thought that she may survive. She started doing a CPR as shown in the picture here now. She started doing the CPR, and in that incident two people died and one person rescued, saved, because of the CPR performed by a ninth standard student. And she got the National Bravery Award for the year 2021 for the extraordinary effort she did. And it was very surprising for everyone how a ninth standard student can do CPR. So it is not there in their curriculum, it's not there in their studies. So later, she mentioned that she's a student. She was a student of NCC, and NCC in one of the camp, it was sensitized to her about the CPR. So if you learn CPR, the point to be mentioned here, if you learn CPR, you can save lives during an emergency. You can boldly come forward and do the CPR. Okay. So next is about okay, this is about in case of any shock. If you come across any person with a shock, I think slides have been changed a little bit here. The topic which we are getting to know now is any person who is unconscious, who is not responding in any disaster. Maybe it is drowning or a fire or any incident for that matter. If the person is breathing and unconscious, we turn him into recovery position. If he is breathing and slightly conscious, we elevate the leg portion so that the blood circulation to the brain is improved. And if the person is feeling very cold because of the shock, we try to cover with a blanket. Okay. All right. So we'll come to the directly to the CPR. We have procedure called CPR. Fainting we just discussed, it's not required. And electric shock. This is again one of the disaster. We cannot consider it as a disaster, but generally we need to have a knowledge regarding electrical safety. And one thing to be remembered, in case of any high voltage electric shock, please don't go near. Please don't go, don't try to save. It is not possible to save, and nobody can survive a high voltage electric shock. Once it ends inside the body, it can cause damage to the muscle, it can cause damage to the nerve, it can burst the heart also. So even the ground also will be recharged. If you go near, you will be the next casualty. So in case of electric shock, the primarily you should maintain a cordon or a distance of nearly 18 meter or nearly 30 feet of distance should be maintained. Make sure that nobody goes near to that. So if your college premises are happen to be within the high tension tower, so you have to request the authorities to shift it, right? So playing under, walking or running or standing under a high tension, high voltage electric pole or high voltage electric lines is again is very dangerous during a rainy season. It can, the ground also may be recharged and can kill a person. Okay. So to remove low voltage current, like the low voltage will be the domestic current, you try to move the object away from the person, and once you move the object away from the person, you can provide the relief as we discussed just now. So domestic current may not be of that dangerous, but it can kill depending upon the time of contact, how long a person is in contact with that machine. Okay. So first try to remove the danger, move the danger away. To move the danger away, you can use any non-conducting objects like a stick or a pole or a broomstick or a housekeeping equipment also can be used. Okay. So once you break the current safely, then you have to provide electrical injury, or electrical injuries can cause burns also. It can cause injuries also, muscle injury. So you have to treat it same way as a burn injury. If it is minor, put the water continuously for 10 minutes. Okay. All right. Then very important is CPR. So what is CPR? When we do CPR, how we do CPR, we are going to learn now. And this is a very important topic in first response. We are discussing about first response during disasters. And during a first response in disaster, the very important topic that everyone should have a knowledge about is about the CPR. So what is CPR? CPR is nothing but cardiopulmonary resuscitation. Cardia means to say heart, pulmonary means to say lung, resuscitation means to say that re-establishing the tissue oxygenation until the respiratory and the cardiac function is restored in the following conditions. So what are the conditions which require CPR? Any person who is severely injured, bleeding, unconscious, not breathing after a road accident, after a building collapse, after an earthquake, requires a CPR. After a person is not conscious and not breathing after electric shock, requires CPR. Asphyxia in case of fire, when there is a lot of smoke around, requires CPR. Drowning in the water requires a CPR. Heart attack, as I was mentioning initially, there are many cases of heart attack reported in India. Heart attack is the commonest one, second commonest reason for the death in India now after the road accident is the number one killer. The second is the heart attack, non-communicable disease. Before 2020, the number one killer was TB, tuberculosis. For your knowledge, I'm just sharing this information. TB was the number one killer in India before 2020. After 2020, COVID became the number one killer. But annual statistics, if you take the yearly statistics, if you take, the number one killer now is the road accident. Number two killer is the non-communicable disease like diabetes and hypertension are related to that, the heart attack or the other complication. So please remember these two issues, address these two issues. It can affect anybody. Please remember that. Have a good lifestyle This is not a part of a disaster management, but it's again a part of what I can say a healthy living. If a person is healthy or fit and fine, he can save 100 other people. So it's very important. So indication of CPR is that. What is CPR? Then we go to the CPR. How exactly to perform CPR? So CPR can be performed with a simple procedure called CAB. Easy to remember the word CAB, Dr. CAB. That's compression. It's mentioned circulation here. Activating the circulation by compression, airway opening, and breathing. How exactly we do it? So first, try to wake up the casualty. Okay, we have videos related to this. I'm not sure whether the video can be played for the reason that because of the yeah. Give me a moment. Oh God, it's shutting down.
Okay. Hope my voice is audible here.
Hope my voice is audible.
Yes, sir.
Okay, okay. Just I switched over from the laptop to the mobile. Audible. Okay, one moment, sir. One moment. ಇದು connect ಮಾಡಿ. Okay, fine. I was just discussing about the CPR and a very important incident related to CPR. One moment, give me a second, please. Hope my voice is audible now. Let me share my screen.
Yes, sir.
Okay, fine. And let me share the presentation of it. Okay, hope the presentation is visible. It's opening now.
Yes, sir.
Yes, sir.
Yeah, it's open. Okay, fine. So we were talking about the very important topic, that is about the CPR. So let's learn about the CPR now. So how exactly CPR should be done in case of any such emergencies, and what is the procedure? Okay, so CPR means to say the cardiopulmonary resuscitation and how to do the cardiopulmonary resuscitation. And let me, by the way, these slides came in between. I will just show you these slides. Okay, I was just mentioning about the drowning related are the slides visible? No?
No, not visible, sir.
No, one moment, one moment. Okay. This is a very interesting part. During flood, commonly, particularly northern part of India, we are seeing flood. Now, due to the climate change, flooding is everywhere. So, life jacket can be prepared using locally available materials like a water bottle, like this, what you are seeing now in the picture. So you can see that the water bottle can be converted into life jacket. So commonly available material like unpeeled coconuts, water bottles, plastic bottles, plastic water cans can be converted into floating devices, improves life jacket during any emergency. I have worked in Assam flood. I can remember that in Assam, the Brahmaputra River passes through the length and breadth of Assam, and during flooding, every home is prepared with a life jacket made up of unpeeled coconut. So that is a commonly used one. Regarding fire, we just learned many things about the fire. Uh, so we are going to CPR directly. Okay, all right. So we just stopped here at this one. First, try to wake up the person. So when you are trying to wake up the person, shake and shout. All right. So shake and shout is the correct method to wake him up. If he is not responding, check the pulsation, carotid pulse. If the no pulsation can be felt, so immediately we start compressing. So where exactly to compress? So identify the coastal margin. Coastal margin means the rib cage, and identify the center of the chest. And in the center of the chest, we place one hand over that, the other hand will be locked like this. Okay. So we start doing a compression by holding our hand straight. The force should be applied from the shoulder, not from the wrist, not from the elbow joint. It should be applied from the shoulder, and the fulcrum of bending is a backbone. So why we do this? What is the objective of doing this? When you do this, the heart will get compressed, and once the heart gets compressed, the blood inside the heart gets pumped to the vital organs of the body, and the compression depth should be 4 to 5 centimeter or 2 inches or 1/3 of the width of the chest from front to the back. Then what should be the rate? The rate of compression is 100 to 120 per minute, and each time when we compress, so make sure that there is a recoil, sufficient recoil, and every 30 compression we give 2 rescue breathing. So every 30 compression we will be giving 2 rescue breathing. So rescue breathing followed by compression should be done. So this is the compression method. Please remember this technique, and please remember that this is a just applying massaging the chest area is not sufficient. You have to compress it, compress hard and fast. So for example, if you have compressed it too hard, what may happen to the chest? Nothing will happen, don't worry. If you have compressed it too hard, nothing will happen. So hard and fast. If suppose accidentally if the bone get fractured, the rib cage get fractured, let it fracture, there is a treatment for that. But if heart stops working beyond 7 to 8 minutes, there will be irreversible damage to the brain, and it cannot be recovered, it cannot be repaired, or person cannot be alive. So then we open the airways. So we open the airway, and once we open the airway, we check for the breathing, and this is how we check for the breathing, not by using finger. Look, listen, feel method, and you can make out the first responder here. She is looking for the assessing breathing by the look, listen, feel method, and she is listening for the breath sounds, and at the same time feeling out breath air for 10 seconds. Then we give mouth to mouth breathing. So when we are giving mouth to mouth breathing, we should remember that extend the head backward, and then close the nose and blow through the mouth. Okay, so that's a method we adopt for mouth to mouth breathing, and that should be given steadily for 2 seconds. And what should be the rate? The 30:2, and always it should be performed on the ground, not on the cot. If the casualty is on the cot, you have to climb the cot and you have to do it. Otherwise, it will not be effective. And CPR has saved millions of lives across the world. In India, the CPR has been practiced by the medical professionals only. Non-medical professionals or the general public are afraid of doing this, thinking that something may go wrong and it may aggravate the condition. No, don't be afraid. This is a procedure which is safe, which can save a life in emergency. But simple thing to be remembered here, the important points to be remembered. For adults, we'll be using both the hand. For children, we will be using one hand. For the infant, for example, if an infant below the age of 5 years accidentally fell into the water and swallowed the water, not breathing, We have to follow the same procedure of CPR, cardiopulmonary resuscitation, but the compression will be done using the fingers, not using the hand. Okay, depth of compression again, it is 1/3 the width of the from the front to the back of the chest. Okay, remember this guideline, the 5 important steps. Initially, we have to start call for an ambulance. Then, before you start CPR, then check for breathing, check for pulsation, then start doing compression and giving bottom up. 30:2, 5 cycles before you apply the AED machines. Okay, so AED machine is the new concept nowadays. It may be available in public places. AED, automated external defibrillator, we call it as. Nowadays, it's available in the public place like shopping mall, bus stand, railway station, even the high-tech buses like Ulu buses, high-tech Ulu. In high-tech Polo, which connects between Bangalore International Airport to the Mysore, they have this AED machine inside the bus. If someone sustains a cardiac arrest or heart attack, at that time can be used, and it doesn't require any expert knowledge to use. It is very simple, very safe to use AED machine. I don't have slides of AED machine here, but remember, if required, probably tomorrow also I can show that. Okay, so CPR is an effective procedure when performed at the within the platinum 10 minutes, and this can be done by a first responder only, not at the hospital level. Don't assume that after a heart attack, if you take the casualty to the hospital within 1 hour, he will be alive. Punit Rajkumar had a cardiac discomfort. He has chest discomfort reported to clinic, and after that he collapsed there. Then he was shifted in a private vehicle, and he was delayed by more than 20 minutes. So nobody provided CPR at that time, cardiopulmonary resuscitation, and he lost his life. And that was tragic example. I can quote. There are hundreds of such people, have such examples every day where people are dying due to the lack of care, lack of first aid, lack of first response during initial 10 to 15 minutes. That's very important. Please remember, if the breathing stops for more than 7 to 8, 10 minutes, if you don't respond, just by taking them to hospital will not make them alive. Okay, you have to respond, right? So this is about the recovery position. In any case of injury, if a person is unconscious, he is not responding after a building collapse. For example, fire incident, this is quite common. Fire accident, there will be a person who will be unconscious but breathing. If they are breathing and unconscious, turn them into recovery position like this. Why you need to turn them like this is because the chest muscle will be in a relaxed state so that they can able to breathe easily, and the chances of vomiting also, if they are vomiting, the vomiters will not go inside. Okay, so how to turn the casualty to recovery position is mentioned here. The step-by-step method of turning the casualty to the recovery position. Okay, so there is a video related to that, and okay, fine. So this is about the CPR, and this is about the various other steps related to CPR. This is about eye related injury. I'll not be taking this now. Probably tomorrow, if it is required, we can take. And there is one more thing which may not be related exactly to the disaster management, but it is required knowledge for a first responder, because they will not be working in area where it is considered to be safe. For example, in earthquake or a flooded zone, nowadays, not only snake, crocodiles are seen. So people, the first responder should have a knowledge regarding snake bite and what should be the first aid for snake bite, because there are myths and stories related to the misconceptions related to the snake bite. And these slides which I am showing just now, it is based on the standard protocol that need to be done. It is not my assumptions, it's not my theory. It is the standard protocol, the national level protocol given by the Ministry of Health of Government of India for the snake bite. So don't apply our own, means your own set of knowledge regarding this. So whatever we have read in the probably in social media, we have seen in social media may not be right also. So first thing, identification of snake is very important. To identify whether it's a poisonous or non-poisonous, please remember there are more than 80% of snakes in India are non-poisonous. Only nearly 12 to 15% are poisonous snakes are in India, and we can easily recognize that by seeing the snake also. If you are an expert, definitely there may be biology teachers in this group, biology professors in this group. They are very much aware about this information. So the poisonous snake will be having a broader head compared to the body. The eyes, the pupil will be elliptical in shape. The scales on the skin will be very close, and this is how the poisonous snake will appear. Non-poisonous snake head will be same as the body, and the pupil will be rounded, and the scales will be far apart. Right? Generally, providing first aid, you need to have the understanding about this. And looking at the bite also, we can make out if you are an expert in related to that. So poisonous snake bite will be having a color change around the wound, will be having a swelling around the wound, and there will not be bleeding at all because of the hemostatic properties of the poison. There are three type of poisonous snakes are there: hemostatic, I mean to say hemotoxic, then neurotoxic, and the cytotoxic. Cytotoxic means to say which can kill the gangrenous necrosis of the cell can happen. That is called cytotoxic. The other side of the picture, you can see that there are multiple wounds. Non-poisonous snake will be having multiple wounds. There will not be any color change, no swelling, but the bleeding will be very profuse. So bleeding will be there continuously. In such a situation, how to manage? So you generally have got 1 hour to 3 hours of time to respond immediately. And when we are responding snake bite, so please remember neurotoxic complications are much more severe, like it can cause death immediately. The person will be having frothing coming out from the mouth, paralysis, stroke-like symptoms will be there. Hemotoxic generally will be having symptoms like multiple rashes on the body, nausea, vomiting, and diarrhea, and it can cause cardiac arrest also. So what's the first aid? Clean the wound thoroughly. First thing is very important is make reassure the person with the victim of a snake bite, reassure him, talk to him continuously, engage him in the conversation, divert his attention, and say that it is not a poisonous snake bite, nothing is going to happen to him, and there are medicines available to in the nearest health facility. So first clean the wound thoroughly before shifting to the hospital. Clean the wound with the soap and the water. Immobilize that portion. Okay, as you see here in the picture, you need to immobilize. We have immobilized both the legs. So remember, it is not putting a tourniquet, it's not putting a thread, or it's not tying. You may have heard about tying above the snake bite mark. No, tying, if you tie too tightly, it can block the venous return to the lungs, and it can cause a respiratory arrest. Okay, so cutting the wound, sucking the wound, tying behind the wound is contraindicated. Please don't do that. It's not of any help at all. It is not going to help. So cutting wound to induce bleeding also may cause severe pain to the person, and he may go for a shock also, because you are cutting the wound without using any anesthesia. Person will be under severe pain. Already he is under shock, and we are aggravating that situation. Should not cut the wound. No point in cutting the wound. No point in sucking the wound. And so if somebody do that, there are lymphatic supply below the tongue that can harm the person who did that. Then tying the tourniquet is also contraindicated. We can use a cloth material to immobilize. The purpose of immobilizing is to prevent the spread of absorption of the toxicity, the poison, to the bloodstream or to the tissues and the muscles. Okay, so this is about the snake bite, and if you have, I'll stop here for the today's topic. If you have any questions related to the today's topic, we can discuss now, because we have few minutes of time before we conclude for the today's session. Tomorrow's session is about the mass casualty management, triage, and other things. So if you have any questions related to this, you can please do ask. Related to the topic which we covered, today's topic basically is about the first response to save a life during any disaster. So that includes during drowning, during fire, during medical emergencies, during road accidents, or any injuries for that matter. The topic was covering related to that. And if you have questions, please do ask. So I'll stop sharing the presentation now. I'll come back to the screen mode where we can discuss. If you have any questions, you can type and send also. Tomorrow also we will take the questions, but before that, very important is before we discussed about all this issue, let us clarify the doubts of the today because you may be having doubts. Tomorrow's topic is something quite different. The doubts of the tomorrow's topic may be different. So if you have any doubts to ask,